We hope you don't have cancer, but if you do, this show's for you. The Stupid Cancer Show!
Hey, welcome back to the Stupid Cancer Show. We are joined here today by Dr. Catherine Benedict from the Stupid Cancer Board of Directors. She entered our world several years ago. I was at a conference in Atlanta for an organization called Critical Mass, and I'll leave it at that. I would love her to introduce herself, talk about why that random epic meeting turned into something truly transformational, and what you're working on with us today.
Absolutely. Changed my life, as probably meeting you does for many people, Matt.
You're hired.
So, hello, community, Stupid Cancer community. I'm so happy to be here. A couple of years ago, we connected. We started working on, what do we need to know about AYA cancer research? What are our priorities? How do we make sure the message of the community gets back to the medical field so that your doctors, your nurses, all providers know what it is that you want, and then also all the researchers know how to kind of work with you in the way that works best.
I think what's really important the distinction I try to make is that the word research itself comes with its own sort of partisanship, if you would. And research can mean different things to different people, whether you do want this to happen or not. And I would say, at least this country's been on overload on cancer research for cure, but then there's also cancer research for hope, for quality of life, for the measures in the times that you're going through the cancer that can make it suck less, but you work on that behavioral information, that behavioral research, and it's striking how under the radar the findings are.
Right. I live in this world every day, and so I forget that the findings about treatments and clinical trials kind of always overshadow some of the stuff that myself and some of our other behavioral and health outcomes researchers do. Right. And I should back up for a second. So I'm a psychologist. I was trained in behavioral medicine, all behavioral science and health outcomes. And what that really means is all things cancer that don't have to do with medical, biological, treatment agent type stuff. So what are your experiences? What are the support resources that you need? What does this mean for your loved ones, your partner, your family, your future? And how do we build resources or interventions? How do we teach hospitals and doctors and providers to make this experience suck less for you? And that's all the research that I do. And it's called behavioral science or health outcomes, but really, this is what research is. It's about making the experience better for you, in addition to very important research that happens over here with medical outcomes and treatment, new treatments. But this is just as important because this is what you live and breathe, and this will affect the rest of your life.
It also helps us redefine what the word cure is, because if you are disease-free, but you have all sorts of crazy side effects, or you've lost your fertility, or you've lost your job, or you have you're on constant chronic disease medications, to what extent is that considered cure if the cancer is gone but it never leaves your life?
Yeah.
And that's also like a bit of a platitude as well, because it may never leave your life mentally, but mentally it matters in this experience. How do we make it suck less mentally?
Mentally, for the long run, for however however much you still identify with cancer in your life, what can we do to make it suck less in that whole trajectory for the whole journey? And so that's a perfect segue. That's my specialty. I focus on the survivorship, quote unquote, survivorship, the post-treatment. Once you're done with the acute hospital, you don't have to go to doctor visits every single day or you're not in the hospital. But what's the long-term effects, whether it's fertility and family building, which I want to talk about more today, financial effects, and then dealing with long-term side effects or having to go all these medical visits amidst your life getting back to normal, quote unquote normal.
Right.
So that's my piece, is the survivorship.
So 20 years ago, in 1998, a group of women who were fighting for were lobbying for some legislation on the Hill, came up with the idea that we should be calling this cancer rehabilitation.
Mm-hmm.
And today that word has its own stigma around opioid addiction and rehab, drug rehab. But the truth is, what we're describing here, survivorship, is another word for helping you to rehabilitate yourself after your treatment is finished.
Yeah, and move on to the life that you want, whether this is, an ever-present or a continuous aspect of your life, or something that you're managing, dealing with, still rehabilitating from, or whether it comes and goes in your life, maybe whenever you need to go in for a scan, or whenever that scan anxiety pops up. But the long-term, what are your experiences and how do we make it better? That's what the research is that I do.
So let's get to the clinical research study that we are partnering with you on. Tell us your health system.
So I work at Northwell Health in the New York area. We probably have 20 different hospitals now.
Right.
I work, entirely in the cancer space. Our Monterey Cancer Center is the flagship hospital. And I work in both the adult and pediatric settings. So we're one of those very unfortunate places that we don't have a designated AYA center or AYA, medical, designated medical space, which is something I'm pushing for.
Yes, yes.
So that's a whole other topic.
Right.
So I work at Northwell Health. I pop in with stupid cancer whenever I can. And I'm running these studies to figure out what I can do, what I can learn about young adult cancer survivors' experiences, to then build it into our practice, the hospital practice, as well as, try and get things nationally known about what it is this community wants and how do we make the system better for you and better serve your needs.
Right, and it's important to create an understanding of the definition of a clinical research study. It sounds intrusive, it sounds scary. All it really means is it helps researchers in the behavioral space like Catherine better understand, as if we were taking a regular, normal consumer survey, but it's directly applicable to practices in medicine.
Right. We don't want to do anything without your input. And so if you've heard of, patient-centered care is a buzzword now, well, this is also patient-centered research, and that the patient voice or the survivor voice, the person voice should be a part of every step and everything the hospital does and everything that we do as researchers. If we're building, anything, if we're everything from a patient pamphlet to, a systems level intervention, we want your input. And so that's all that this clinical research is, asking for feedback, and so that we can learn from you. And then as we move along, asking for, feedback again. And we just really want to be mindful that it's aligned with the goals of the community and being done in the way that's acceptable and beneficial and
applicable
to the community. Right.
It's translational in the sense that how can we get it from you telling us about your interests to stratifying the data that you receive to implementing it in a meaningful way in care. We don't know best. You guys know best. We just want to learn and then build things that are, for nothing for you without you, right? The flip of it is how egalitarian. So we're going to throw a link to the study in the description below. It will be stupidcancer.org/research or /research study or /study, something along that line. But really quickly, what's the top line for this, and what are you hoping to get out of the results?
Okay, so a big focus of my work is on fertility and family building. But the huge banner here is that it's more than just fertility preservation. Fertility preservation and fertility counseling before your treatment begins is absolutely necessary. It is your right as a patient to be counseled and to be informed of any risk that your treatment has to your fertility. In addition, there is critical things that you need to know after treatment also about what are the next steps, what do I need to be thinking about in the future if you want to have a child. And there's no value there, but if you do, then there may be reasons that you need to plan ahead medically, financially,
mentally, says the father of twins.
Exactly. And so I work in the space of fertility and family building a lot. The financial piece is very near and dear to my heart because, as we all know, nothing is free, and particularly with healthcare in this country, and long-term financial effects of cancer itself. And then if you do experience some fertility problems, what is that going to mean for you in terms of, IVF, surrogacy, adoption, both, again,
right,
medically speaking, mentally, getting
right.
your brain around all of these things, and then financially. So this study is just to learn about those experiences so that we can then build the resources in the post-treatment phase to make sure that everyone's being informed, their rights are being respected.
And I can't stress enough that this is an innovative, not overusing that hyperbole here, there's never really been a research study like this ever before. So again, just inherently, it is progress for young adult cancer that this exists, that you exist, that this exists, and we're going to have information for the very first time.
Exactly, on this family building piece. Like I said, the fertility preservation is very important, and that research has to be done, and all that counseling has to be done. But that is not where the story ends, and this really is the first study to say, what are the experiences when it comes time to think about IVF, surrogacy,
right.
adoption, or, even if you don't have any of those problems, what do you need to be doing to ensure that you'll be,
right.
kind of, where you'll fall in terms of what your goals are for having children, where you are financially, how you talk to your doctor, and really, this is the first study to explore kind of that piece to it.
It's a really big deal. So again, we'll throw a link in the description below. Yeah. We encourage our entire female community out there to share their stories, participate. We say, be the research. This is the research we can be to truly make it suck less for people like us. So, Dr. Catherine Benedict, thank you so much for popping by the Stupid Cancer Studios here, and we'll see you next time on the Stupid Cancer Show. Hey guys, thank you for watching this episode of the Stupid Cancer Show. We are here to make young adult cancer suck a whole lot less. For more information about us, visit stupidcancer.org. Subscribe below to this channel to get notifications of all the new episodes we're going to be posting this year. And don't forget about visiting us on all of our social channels, Facebook, Twitter, Instagram, Medium, Vimeo, whatnot. Thank you so much. Take care. Bye-bye.